I'm honored to be invited to participate in the 36th Great Wall International Congress of Cardiology and Asian Heart Society Congress 2025 held in Beijing. My presentation is devoted to experience in providing emergency care for myocardial infarction in Armenia. Armenia is a small country with 3 million population located in the Caucasus region, and the majority of population live in capital city Yerevan. Cardiology service in Armenia is held in 12 cardiology centers and specialized cardiology departments in Yerevan and 4 in the region. All are equipped with intensive care units. 12 angiographic laboratories are located in Yerevan, 4 in regions, and there are 3 cardiac surgery departments in Yerevan. Prevalence of coronary artery disease increases not only in the world, but also in our country. And the number of patients with acute coronary syndrome is approximately 6,000–7,000 per year, of which from 2,700 to 2,800 have STEMI, and 3,500 to 4,000 have non-STEMI. According to my personal observations, there is an overdiagnosis of unstable angina in 20–30% of cases. This is both non-coronary pathologies and chronic coronary syndrome. In our country, approximately from 2,500 to 2,600 per year primary PCR are performed. Currently, cardiology service in Armenia is based on 2023 ECS guidelines for the management of acute coronary syndromes. And now I want to represent the situation with laboratory diagnostics in Armenia. Currently, high sensitivity cardiac troponin test is available in 16 centers with angiography services. In most regional medical services centers, qualitative troponin tests are used. The unavailability of high sensitivity cardiac troponin test often hinders timely diagnosis of myocardial infarction and the correct choice of management strategy in the regions. This increases the frequency of unnecessary hospitalizations and prolongs the hospital stays of patients without acute coronary syndromes. And now let's consider the distribution of angiographic laboratories in Armenia. 12 out of 16 angiographic labs are located in Yerevan, capital city of Armenia. Having only 4 regional centers does not always ensure timely first medical contact and delivery of the patient to an angiographic laboratory within 2 hours, according to the ESC 2023 guidelines. Here is an estimated delay time according to different locations of major cities of Armenia. As you can see in this slide, the main delay time from first medical contact to PCR center is 118 minutes. Now let's talk about the actions taken to improve the situation. Armenia joined Stand for Life initiative. Stand for Life is an important program to improve the treatment of patients of STEMI with the goal of reducing mortality from STEMI. The objective of the initiative was to increase the number of STEMI patients undergoing primary PCR and to ensure that centers in participating countries were capable of performing primary PCR on 24/7 basis. This initiative, active from 2008 to 2016, included 23 countries, mainly European. Under this initiative was continued as a new one, which called Stand Safe Alive. Now I will introduce the state program for free primary revascularization in acute myocardial infarction in Armenia. Since 2015, Armenia has implemented a state-funded program providing free primary coronary angioplasty for patients with acute myocardial infarction. Myocardial infarction criteria are listed below. It's the presence of universally accepted myocardial infarction criteria according to the universal definition of myocardial infarction with elevated cardiac troponin, PCR of the infarct-related artery within 12 hours from the onset of clinical symptoms, and at that time only PCR of the infarct-related artery with bare metal stents were permitted, using more than one stent if necessary. In July 2018, the first changes were made to the program. Instead of bare metal stents, drug-eluting stents are used. In 2019, in addition to patients with STEMI, patients with non-STEMI are also eligible if they have an infarct-related circumflex artery. Starting August 2026, all patients with a documented diagnosis of myocardial infarctions will be included in the state program, regardless of the presence or absence of ST segment elevation. Currently, 14 centers participate in the program. All of them are operating on 24/7 basis. If the inclusion criteria are met, the medical center signs an agreement with the patient or his representative. All inpatient treatment, including primary coronary intervention, is provided free of charge. However, any subsequent elective stenting of non-infarct-related arteries or stenosis during the same hospitalization is carried out on a paid basis. Since the launch of the program on January 2015, approximately 23,000 patients have received free primary stenting within the first 12 hours of myocardial infarction. The results from the first year of the program were presented at the ESC Congress 2016 and at the European Scientific Forum. As a result of program's implementation, in-hospital mortality for STEMI in Armenia decreased from 8-9% to 3-4%. Currently, it is around 2-3% among patients enrolled in the program. Now about limitations and weaknesses of the program. The inability to fully meet the ideal time threshold for primary coronary intervention in STEMI patients, 90-120 minutes, remains a challenge. Studies have shown that longer system delays are associated with higher rates of mortality in STEMI patients. First medical contact to primary PCR time in Yerevan is less or equal 90 minutes. In the regions, depending on the patient's distance from the angiographic center, the first medical contact to primary PCR time ranges from 120 to 180 minutes. A lack of the ability to administer fibrinolic agents by ambulance teams or at the point of first medical contact in cases where the expected time to possible revascularization is more or equal 120 minutes. Moving on, let's speak about rehabilitation and secondary prevention. Patients with myocardial infarction in Armenia. Armenia is among the leading countries in smoking prevalence among EAC member states. A government program to combat smoking has been initiated. Lifestyle modifications under control are followed in approximately 13–15% of cases, primarily monitored by family physicians. Patients' compliance to prescribed pharmacological therapy, statins, antiplatelet, 1 year after acute coronary syndrome is about 50–60%. A program for psychosocial and physical rehabilitation, as well as the training of specialized professionals, is currently under development. In the end, about plans and prospects. About National STEMI Registry. Patient enrollment in Armenia's first National STEMI Registry is nearing completion. The registry will provide reliable statistics on STEMI cases and insights into adherence to modern treatment guidelines. Future development plans include adding a thrombolytic component to the myocardial infarction state program and improving the national emergency medical service systems through centralization and modernization. Thank you for your attention.